Hello everyone. So we are here live to answer a lot of queries. I think we were totally bombarded with the queries regarding the Gazette that has been recently released for the next exam. So let me first of all give you the implication of the Gazette release. Once the Gazette is published, it becomes the law of the land, and hereafter these are the regulations which are going to be followed for the next exam. So I want all of you to first of all see some key points that I wanted to highlight. I will take your strategy queries also, which was the original idea behind today's video, but I saw that this Gazette has been published, so I thought why not discuss this further. Okay, so first of all I want to bring to your notice that it is in Hindi and English both, but if there is any difficulty in understanding, we have to take the English version that is written in the Gazette itself. Okay, now so first of all I want you to see a line that I wanted you to actually notice. Very important line, this paragraph, point number 5. Point number 5 says, whenever the next is in force, corresponding equivalent, I want all of you to read this, corresponding equivalent existing exam shall be phased out or cease to be applicable for purpose of which next will be. So it will be phased out. However, if previous batches are applicable, then existing exams can continue for the time deemed appropriate by the board. So I think this was clarified in the meeting also, that for the current interns and post-interns, you will have a NEET PG exam. So first of all, before I start anything, I want to talk to all the interns and post-interns and even the people who are waiting to give a NEET PG, who are in a government job or any other reason. This is your opportunity. In the interim period, they will do a NEET PG. So please look at this year's NEET PG with full seriousness. Don't, if you are thinking as an intern that I will take a drop and then I will study, it is not a good idea. It is better to focus on this NEET PG. So this is the opportunity. It is given in the exam as well. Now what will happen is, they will also allow you to appear for the next part 1. So how will they calculate the equivalence of the two different exams? One is NEET exam, one is NEXT exam. So if you see, they have used a word normalization of the scores. Normalization is a statistical term in which the raw score is what you actually get in an exam. If I convert the raw score into a percentile, then I use statistics to extrapolate that how would you have performed in a different exam. I get a normalized score. Normalized scores are used by National Testing Agency, otherwise also for the common university entrance exam, and a new word that has been now we can see is normalized. So some people will appear for NEET, some people will appear for NEXT, and they will use the normalization of score wherever appropriate. Now I am going to go into another point that I wanted to highlight. They have written one or more type of MCQ exams. This is a standard AIMS line. I am sure those of you who have given a AIMS PG entrance in the past or INI-CT, it is written one or more type of multiple choice questions. What are the different types of multiple choice questions? Most common is single best answer, but other types are like you have a combination type of question in the AIMS exam, match the following type of question,
true and false,
assertion reasoning, true false. So you could have multiple types of MCQ paper. They have not mentioned single best answer, so please note it very carefully. Second thing they have said is the paper would be this. I explained in my previous videos also: medicine, surgery, obs and gynae, and allied disciplines. With medicine, the allied disciplines are psychiatry, dermatology, radiology, surgery, radiotherapy, and anesthesia. Orthopedics are the allied disciplines. But they have also mentioned very important. Okay, I am zooming in for you. The next part 1 will happen twice a year, months of May and November. So May and November it will be done. Now many people are confused, how will we repeat if we are not satisfied with our score? So I want you to read this line. I just tweeted about it on my Twitter account also. If you are not following me on Twitter, please do it. I will give you the authentic information. So they are saying there is no restriction to number of attempts. आप कितनी मर्जी बार दोबारा दे सकते हैं next part 1, but provided you have passed both next step and 1 within 10 years of joining MBBS.
Right.
So ये बहुत बड़ा word है जिसको आप लोग अभी नहीं देख रहे. Joining MBBS joining से, passing से नहीं कह रहे, joining से within 10 years you should pass part 1 and 2, then you can repeat the exam. So you cannot repeat next one immediately, you will have to pass the part 2, then you can repeat. Very, very important. Okay. Okay. Again the same line, that no restriction to number of attempts, but provided that you are giving the improvement by giving next part 1 after passing next part 2. So पहले part 1 part 2 pass करो, उसके बाद improvement के लिए paper दे पाएंगे. Okay. So I hope this is clear. Another thing that is now we can see from the next step 2, they have changed a little bit from the what they were telling earlier. The next step 2 will have practical, clinical, viva voce, simulation and case-based test of all these specialties. So orthopedics is also added other than the other subjects, and the pattern will be OSCE, clinical case, simulated patient. All these will be used, and practical skills will also be tested, like intubation, like your resuscitation, CPR, they will also be tested. And next part 2 will also be twice a year. Please notice, it will also be twice a year. But the important thing is, they will test you for 7 subspecialties in next part 2. If you fail in 1 or 2, there will be supplementary. If you fail in more than 3, you will have to appear for the entire paper again. Okay, please see, if a candidate fails in more than 3 subjects in part 2, you have to appear for all 7 subjects in the supplementary. That's very important, that supplementary exam will happen for next part 2 also. But if you fail in 1 or 2, you can repeat in those specialties. If you fail in more than 3, you will have to appear for all 7.
Also, just adding here that, this is apart from the practical exam which will happen at the end of your final professional year. So final professional year, there is no written theory exam. There will only be next one. But for your final professional year, you will have a practical exam at the end, and you will have next 2 also, which is going to be based on your final year subjects again. So it is actually twice. And in the next 2, apart from, as they've mentioned that they will be asking about these subjects, they will also be asking you about clinical skills, right? As Dr. Sumay just mentioned.
Now, the marks in next step 1 will be calculated as whole number, which will serve as the raw score. Raw score का क्या मतलब होता है? It is a new statistical term for you. Raw score मतलब the score that you actually get in an exam is called as the raw score. फिर they will convert it into percentage to the decimal numbers also. So you will have total score, raw score that you achieve in different subjects, and then they will calculate the percentage. Next part 2 will only be pass and fail. We have already discussed this in multiple of our platforms. But there now you have a complicated thing. पास करने के लिए 50% मार्क्स चाहिए. टू पास यू नीड 50% मार्क्स, ओके, आउट ऑफ टोटल, बट यू हैव टू पास इन ईच ऑफ द पेपर. Each of the 6 paper you have to have 50%. Okay.
Please listen to this very carefully. Yes.
Okay. And very important that suppose, now read the scenario. Suppose you pass in 2 subjects and fail in 4 subjects. You can appear for the next step 1 again, and if you pass in the rest of the 4 subjects, you will be considered passed. ओके, मतलब आपको अगर आप 2 में पास हो गए, 4 में नहीं पास हुए, तो आप दोबारा पेपर दोगे
और आप पूरा पेपर दोगे,
पूरा पेपर दोबारा देना है. अगर लेकिन उन 4 में पास हो गए तो आप पास हो जाओगे. दूसरा देखते हैं, एक और क्राइटेरिया देखो, उन्होंने लिखा है इफ यू पास इन 2 सब्जेक्ट्स, फेल इन 4 सब्जेक्ट्स, ओके, दैट देन यू कैन रीअपियर. अब दोबारा दिया, अब की बार 2 सब्जेक्ट में फिर पास हो गए.
You have to give again.
Okay, then you have to give again all 6, and then if you can pass in the rest of the 2, you will be considered pass.
So which means, please listen very, very carefully. There is no doubt that you can do a reattempt. Okay, you can do a reattempt, but you will have to reattempt all the papers again. It's not the only ones that you fail in. Second, even if you pass in a few subjects in your second attempt, you'll have to give another attempt. So until you pass in all subjects. But when it comes to your NEET scores, Dr. Sumair will also emphasize this, only the score of your last attempt will be considered. Which means you cannot give a repeat exam with the mindset that, okay, I will only do good in the 2 subjects that I failed. Because if that is your mentality and you don't score well in the other 4 subjects, your total raw score will reduce and your eventual application to post-graduation, your ranks would be lower down, right?
So इसको दोबारा समझते हैं, वो 2 में डिवाइड किया उन्होंने, एक तो पासिंग को अलग किया है और पीजी एंट्रेंस को अलग किया है. So for post graduation they are saying PG admission will only be according to sum of raw scores obtained in each paper and subject in a single next step 1 exam only.
Yes.
That means मैं पिछले वाले के 2 सब्जेक्ट और इस वाले अटेम्प्ट के 2 सब्जेक्ट नहीं ले सकता, मुझे एक ही अटेम्प्ट के सारे टोटल लेने.
Which means you can't say take my opthal and ENT scores of the first paper because I did good, take my medicine and surgery of the second attempt and take other of the next attempt. No. Even if you are reattempting, for whatever reason, if you are reattempting, the raw score of your latest, जो सबसे बाद में दिया है, the raw score of your latest next one will be considered. So again, every time you give the paper, it has to be as if you're going to prepare best for all 6 subjects, not only the ones in which you probably didn't do well.
Okay, second thing is the score will be valid for 5 years. ठीक है, but if you appear in next cycle again, अगर आप next दोबारा दोगे तो previous score will become invalid. As soon as you appear for the paper again, the previous score becomes invalid. Only the last attempt next step 1 score can be considered. Only the last attempt next one will be used. Now also the tiebreaker is very important to understand here, and it's very statistical also. And you will see after my video, everybody else will tell you all this what I'm telling you, because it's very, very statistical. Reason I'm able to tell you is because of my experience as an educator for last 20 years plus. I have seen the scoring system across the globe. So what they have used is they have used a term called as normalized sum of raw score. It's very different. That means if there is a tiebreaker, पहले तो raw score पे rank निकालेंगे. Okay, everybody listen to me. Rank होगी raw score पे. लेकिन अगर बराबर आ गया स्कोर तो then they will use normalized sum. Normalized sum is not the actual score. Normalized मतलब आपका जो आज स्कोर आया उसके हिसाब से what is your percentile, and then that percentile will be extrapolated into how you would have performed in the current year's exam, and the normalized score will be taken for tiebreaker. Okay, if that does not work out, candidate with lower number of attempts will be given higher rank. जो कम attempt में पेपर दिया होगा उसका रैंक बढ़ जाएगा.
Candidates who do well in these exams.
उसके बाद नहीं तो फिर मेडिसिन वाले जिसके हाई मार्क्स होंगे उसको प्रेफरेंस, देन सर्जरी, देन ऑब्स गायनी, देन पीडिया, देन ऑप्टो, ईएनटी, इन दिस ऑर्डर. So the marks that you obtain in medicine will have highest value even in your tiebreaker, and ophtha will be at the lowest weighting in the tiebreaker in the following criteria. Okay. Okay, so I hope you are now able to follow. I am again repeating everything in English without the sheet also. The score that you get in next part 1 will be valid for 5 years, but you can repeat again after giving and passing the next part 2. Within 10 years of joining MBBS, you can repeat your next part 1 again. Okay, but as soon as you repeat, only the current next one score will be valid, the previous one will become invalid. Okay, that's the moral of the entire thing. And also they have said that for Indian graduates, you will have next part 1 theory as well as university practical course. For foreign graduate, because they have already passed their practical in their universities, only next part 1 theory has to be passed.
So please, FMG students or bachas in the chat group, you've been asking, Dr. Sumay, maybe you can repeat this for our FMG students as well.
For foreign medical graduate, what will happen is, please see, you have completed your undergraduate medical education overseas, and when you come to India to do internship in India, because now it is compulsory, you will have to pass in each of the 6 theory papers as specified already. Okay, they will not take your final year practical again. After internship, you will also have next part 2, just like any other graduate.
Yes.
Okay, so these are the broad terms. Again, this another point that I wanted to highlight, I think some of the people are misunderstanding it. Must know and nice to know will be 90% of the paper. The rare thing or may know things are only 10%.
Yes, so stop
So
reading
don't run
unusual
after
things.
unusual things. It is going to become counterproductive. Second thing is, many people are now saying that why not do hours and hours of videos? It will not work out because the cycles will become 6 monthly.
Yes, in
Next
fact,
part 1 will happen every 6 months. Part 2 will happen every 6 months. The mantra will remain crisp, concise, conceptual teaching.
yes, the idea is to know your basics, to know how to apply your basics. How can you clinically correlate different subjects as well as different topics? This is what is going to be the pattern. And if you, students who are already studying with us would realize that we started this almost couple of years back, right? Integrated teaching you allied concepts of basic sciences with clinical sciences. We even did integrated MCQ sessions with a 2-teacher perspective.
We've already started workbook based teaching to give you more concepts, and we have also started simulation based practicals which are already happening across the country with in the DAM centers. So we are, we believe in looking at what is the change and how we can be the forerunners so that our students can get the maximum benefit. But I want you to remember, 3 papers, 120 questions, 3 hours, 3 papers, 60 questions, 1.5 hours. These are going to be your time limits. I don't think time will be a problem, but the questions might be a bit longer, because for 120 questions, 3 hours is very long unless you have longer questions.
So somebody is asking, counseling will be held twice a year. Yes, I think.
Let me explain.
Okay.
So it is already there.
Well.
For the postgraduate admission, the counseling will happen once a year, May and June. But I want you to read the bottom line. There will be another counseling in the month of December for the seats remain vacant. मतलब एक बड़ा counseling May June में and a smaller counseling in the month of December.
जिसको आप mop up बोलते थे basically. So the vacant seats के लिए one more counseling session will be held in the month of December.
Okay, so it is already there in your. This gadget has everything, but I know that it's difficult to read, so I thought I will read it with you. Okay, so I am with all my bachas. Trust us, we understand what is going on, and we will be able to guide you further as well.
Okay, negative marking most likely yes will be there, because anyways they are doing the negative marking even in the mock exam.
But I personally feel for a qualifying exam, if they don't have negative marking, it should be better for the students. I have put in my word. I have also tweeted about it, that in a qualifying exam, putting a negative marking is little bit harsh for the students, and I have already put my word also.
Also, somebody is asking when will this happen first. So my 2 cents on it, and Dr. Sumay may agree or not. I don't know. We haven't discussed, but most likely yes, the exam will happen this November itself. अगर ऐसा नहीं होता
तो मई में होगा. It is like what they are saying is that November and May they will do it. But what we are thinking is that there are students who have internship, like in many colleges they have an internship starting in January.
Yeah.
So will they wait till May for them? So it's like as of now, अब आप एक fixed exam structure की तरह मत सोचें. हर 6 महीने में पेपर हो रहा है. The government is clearly saying that the paper is going to happen every 6 months. If you are eligible, give it. If you are not eligible, give it in May. So let's see how it happens.
Also simply because otherwise they wouldn't have hurried to give you all these details in a span of 2-3 days. Do you feel the urgency that they have to go out on a meeting with all college students to quickly release the Gazette, right? So outside office hours, right? So this is all very unique, and they do have a purpose in mind. And especially knowing that there are colleges who finish their final year in December and they are on schedule and they start their internship in Jan, most likely, yes, the first paper would happen in November. And as Dr. Sumer said, there is nothing to worry about it, because even if you are not eligible, you can give the May session.
So it is like their paper can happen in May or November. It is already written, and plus any months they deem necessary is also written there in the Gazette. If the students have an internship in January, it may happen in November, it may not happen.
Yes.
I know Madam is very sure on it, but I have my...
No, I'm not sure, I'm
putting a little bit doubts here. It is not clear from the Gazette when the first NExT will happen. Second thing I want to say is that there is no clarity about when the foreign medical graduates will appear for it first. It could be that they may have a separate December FMG exam, they may not have. If I am a foreign medical graduate right now, I will start preparing for my FMG exam with at least, starting with the clinical subjects I should be doing, and that is what we are starting in our DAMS FMG batches also. We have started to teach FMG students for the clinical subjects at length, or we have also started them on simulation practical training. We have already started for foreign medical graduates
Okay,
also.
the same things apply for INI-CT as well, as Dr. Sumer mentioned. Most likely INI-CT we may have a session.
Yes, in this November you should have a separate INI-CT exam. But once the next part 2 comes into play, fully, that means part 1 होने से नहीं खत्म होगा, part 2 भी हो जाएगा, तो उसके बाद there is no sense of having other exams, because even the students from Institute of National Importance will have to give NExT. It is written in the
everybody
Gazette.
has to give NExT eventually. After the interim period, everybody has to give only one exam, and that is NExT.
So we thought, like, based on what we have learned so far, we thought let's talk about some timelines.
Yes.
Okay.
Timelines and strategy, and what are all going to be the DAMS initiatives for anyone who is preparing for the upcoming exams.
Okay. So let's start by looking at, are you a Indian medical graduate or a foreign medical graduate? Okay. And the exams will happen in May, November. We don't know if May 24 will be the first or November will be first, but it could be might as well be November. Looking at the speed at which things are happening, that is what actually Madam has said.
Yes.
That we are so surprised that
They are just in a
seminar
hurry.
is happening. Next day mock test dates are coming. Computer centers are getting booked, and the
Next
Gazette
day
is released.
is coming.
I think everything is already made, and they are just releasing one by one. So what we are thinking is that if with the speed that they are going, it might as well be November for the people who were supposed to start internship in January.
I mean, it's
So
not
please
mandatory
keep
for
it in mind.
anyone to give it in November
Please
itself.
keep it in mind that it is not a mandatory thing. The exams will happen every 6 months, and there will be some cutoff qualifying criteria which students are supposed to give which next exam.
Yes, they will come up with that details. Who is eligible for the November sessions or who is eligible for the May sessions?
Okay, so right now, if I look at somebody who is an intern or a post-intern, please think about this NEET PG very seriously. I know some of you interns, especially down south, you were thinking ek bar internship, we will finish the internship and then we will prepare for the exam. I would suggest otherwise. Let's do it for this exam itself. This is probably going to be the last NEET PG in the current format. Okay, so your timeline should be, you have enough time. NEET PG can happen anywhere between January to March. This is what they said in the meeting also. It could be February, it could be March. But the goal should be that you should have your content, tests and revision strategy in place.
And the idea that they are specially mentioning about the interim phase makes me sway towards the other side, because they have been specially talking about the interim phase. It looks that they could start from May of next year as well, right? And that is why they're looking for the interim phase, and that's why they said that exams that needed to happen in the interim phase will happen before they actually switch over or swap to NExT.
And this could even be the December FMG exam. So December FMG, they could move either ways. ऐसा भी कह सकते हैं कि दिसंबर में FMG exam लें, and ऐसा भी हो सकता है दिसंबर में वो FMG ना लेके NExT लें. But as of now, it is open to both the sides. Okay. So what we are trying to say is that if you are an intern, we would strongly suggest a course that you can do very, very fast. Many students have asked, कि sir DAMS का कौन सा course अब करूं? I have very little time at hand. So there are two courses. One is NEET PG TND on the app. Second is Ultimate Live. Reason I'm saying two is, suppose your last 2 years you were not studying and now you are starting to study. Please take the live course, Ultimate Live, and do the content. Use the hard copy notes. Go fast.
How do you decide? If you feel your concepts are weak, then you need to go to Ultimate App Live. The reason being, the paper is going to be concept and application of concept, basics asked in an applied format, basics asked in an integrated format. So if you feel you lack in concepts and you have never done your theory very well, then it should be the Ultimate App Live course. If you feel you have read your subjects once, you have a good idea about the concepts or hang of concepts, you need test practice, you need revision practice, you need MCQ skill, you need a quick time to revise, then it should be the TND. So that is how you decide whether you take one or the other. The inclusions in both the courses are almost the same. The only difference being the live class. So in the Ultimate App, you will have live classroom program for all 19, while TND is a TND kind of a program
Test
which
and
is
discussion.
live.
So
Right, a
if
test
you
paper
have
followed by
your
a
content,
discussion.
if you have your material, you can use the test and discussion to revise. If you are still starting, you can use the ultimate live class where the regular classes would happen at the teaching you in the live classroom with chat box. Second thing is, that is I think the more critical thing, if you are final MBBS
Yes.
and you are just starting, we thought that how can we help the final MBBS students who are just starting.
Final MBBS, third MBBS, okay, third and fourth, both your students, anybody who is targeting the next exams, what should be the strategy starting now? Okay.
So DAMS has a course which covers third and fourth year subjects, which we started keeping in mind from 2019 that one day they will implement NExT, and for last 4 years they were saying they will implement. So we've already made the change. We made a single course where only the clinical subjects are taught, that is third and fourth year, that is foundation. Now the course is already ongoing. So some students said, sir, we are starting now. So the big announcement right now is, in the DAMS foundation course on the eMedicos app, a new cycle is going to start from July.
Yes,
And from July,
itself.
we will cover the 6 major subjects.
Yes, so our focus in the new cycle, so that anybody who wants to start now has an equal opportunity. So our focus in the new cycle will be to cover mainly the 6 subjects until November, right? So that you have enough time for revision as well. So we will be focusing in this new cycle on the foundation live course on the app, on medicine, surgery, gynae, pediatrics, ENT and ophthalmology. So these 6 will be of importance for anybody who starts now because the time is less. So if you have never studied or you weren't really looking for an exam this early, this is what it should be. These would be live classes. We would be covering everything. It has to be, DAMS is always known for its content. We know how to deliver the content, what to deliver in the content, keeping it concise and crisp, but at the same time, very, very, very high yielding, right? So this is what our goal will be when we come to teach you on the eMedicos app for the foundation live course, where a new cycle is starting from July.
Some of the final years and third years are part of our DAMS Ultimate Live program. So to help them also, what we have done is we have included these foundation lectures in your Ultimate Live subscription also.
Yes.
So that you will have to, because you are our premium customers and premium students, we have included both the calendars for you.
So no need to panic, whether you are in the Ultimate App Live course or the App Live, Ultimate App Live is our premier course. You get access to everything. So doubt, ma'am, I have just joined the Ultimate App Live course. Will I get access to these new cycle of classes,
Yes.
live classes? The answer is yes. The course is already mapped for you. You will be able to attend these classes live if you wish so.
So one of the questions that many students were asking is that I am starting now, what to do? We are giving you an anchor with the foundation course.
Yes.
This is the time tested course. Clinical subjects are forte of DAMS, that we have known for the strength that we have in these subjects. And also we have for medicine multiple teachers teaching different specialties. In surgery, different specialists will be teaching different topics. So what we have done is, over the years we have evolved into a cohesive group of educators who are sub-specialized into those topics. Somebody would be teaching CNS. All this will happen with a workbook based teaching. So I feel that we should be able to crack the formula for NExT, where 60% of the questions will be from the must know, 30% from nice to know, 10% only may know. So it is not going to be unusual. The usual things will be asked.
Okay, just a doubt before we move forward. What about post-interns who are a part of our Ultimate App Live course? So please listen to me carefully. For people who are post-interns or interns who are part of the Ultimate App Live course, you should be targeting the NEET PG exam, which is going to be probably the last NEET PG. You should be trying to make the most of it. The exam is likely to be held anywhere between January to March. So your goal should be prepare exactly what the NEET pattern is, right? So try and cover your third and fourth year subjects, right? Then go on to maybe SARPO, they are high yielding, and towards the end you can keep the volatile subjects as well. Okay.
So even in the foundation course, the next cycle will have these subjects, but don't misunderstand, you will have all 19 subjects recorded videos with you,
Yes.
so that you can have the extra edge. To
Yes.
get the extra edge, you have to score good in the shorter subjects, into your skin, psychiatry, radiology, orthopedics. So all those parts of the allied will also be there. They will also happen live later on, but in the first priority, we will finish these 6. The schedule for the course is already there. When you go to the eMedicos app, in the foundation course, when you click, you will see a calendar icon. All
Yes,
the courses,
on the top right corner.
all the courses in the DAMS app give you 1-day free trial. You click on the calendar icon, you will see the total schedule where you can see how the subjects will be taught.
Yes.
I have already asked the teachers that if they can go extra mile in these lectures, interact more, discuss more, although they are already doing their best, but I have asked them to give their 120%, 220%. We will, give all we have. We are not a pre-recorded platform. We are a live platform where teachers work with you. Teachers work with you. And that is the strength, that when the change happens, we are able to adapt fastest. The recorded apps must be recording their lectures 2 months later. They will definitely look at something, but we are going to do it tomorrow onwards.
And also, yes, somebody was asking what is the weightage of allied subjects in NExT. So every paper, so there are 6 papers for NExTexam. Every paper will have 10% questions. So out of the total of 120, 10% questions would be from basic sciences, and they would be asked in a clinically integrated or clinically relevant manner. Okay.
The second thing that we thought was, what about the students who are right now with us in your foundation, Ultimate Live or TND? How can we help them for the NExT? So we have started an initiative from, I think I said we'll start from 3rd or Monday, every day almost, or alternate day. We will start with NExT clinical live daily sessions. So what will this mean? What will they mean? Every day at 9 p.m. on the eMedicos app. Now, first of all, who all can access it? First of all, who all can access it?
We are going to give, so these are live MCQ discussion sessions. So we are starting with live MCQ discussion sessions on the app. They will be in the format of the NEXT PG exam. Right? Now, these MCQ sessions will be held from 9 o'clock to 11 p.m. at night. Okay, so 9 to 11 p.m. at night. All our bachas, so whether you are enrolled into Ultimate App Live or you are enrolled into Foundation Live, right? And even if you are enrolled into face-to-face program, TND. Even if you are enrolled into TND, or even if you have taken Back to Basics, which is the pre-recorded video section of DAMS, right? So no matter what course are you with us, we are going to give you access to this. This is the time when we need to be there for you. So we will hold these clinical live MCQ sessions. It is free for anyone who is a part of DAMS. You can access it. Okay. It will be topic-wise MCQ discussion sessions. Again, the entire calendar has been updated for you, especially for next 3-4 weeks as far as clinical live sessions are concerned. So again, you go to your course in the My Courses section, you see the inclusions, you will see the NEXT clinical live. Click on it, top right upper corner, you can see the calendar. The topic is mentioned, so you can actually revise the topic and come before these MCQ sessions because it will be topic wise. We will be giving priority to only 6 subjects initially, that is medicine, surgery, obs and gynae, pediatrics, ENT and ophthalmology. So in these clinical live sessions, these would be the first 6 subjects that we would be covering with MCQ discussions in an analytical format. But the topic would be covering things which are must to knows and nice to knows, right?
What has happened in the paper is that they are saying 60% of your paper will be analytical questions. Now, how do you approach these analytical questions? Now, if I go into longer length lectures here, when you have already studied your notes, you have already done it, it will be difficult. So we have kept them short and sweet, but we will do it at frequent intervals. The calendar will be given to you and 6 analytical questions will be approached with the teachers, and I'm sure this would allay your fears. It will, help you with your anxiety. Whatever you're feeling, the teachers will be there to guide you. And in every of these 6 subjects, we have divided into topics. We have worked very hard in the last few days to convert it into a program, and there will be topics written, and there will be what topic will be discussed on which day. It will be MCQ oriented teaching. It will not be theory teaching. It will be MCQ oriented teaching.
Should
so that you should have
attend? Absolutely, yes. It is for all of you who are preparing for the upcoming exams. You know, even in NEET, you would realize that there are good number of clinical questions or applied questions. So that is why we are giving access to anyone, whether you are a TND student or Ultimate App Live or pre-recorded videos, whatever it is. And yes, it is going to be a must do. It is going to give you an edge, especially in the 6 subjects that are desirable, right?
Okay. Second thing we are doing is, if you go to your online test series, on the eMedicos app, you will see a schedule for new GTs on the next pattern. We will start taking papers of medicine, surgery, obs gynae with 120 questions.
Yes.
Pediatrics,
So,
ENT ophtha with 60 questions.
We were already preparing ourselves for this upcoming news of NExT. So we are already starting the next pattern grand test from July itself. So please listen to me very carefully. In every month, you will have 3 grand tests now. Okay, listen to me carefully. On the second Sunday of the month, Dr. Sumay will write, on the second Sunday of the month would be your first NExT pattern grand test. The subject would be mentioned there in the schedule for you. On the third Sunday of every month, you will have a NEET pattern grand test, which will have 300 MCQs. So the next pattern grand test would be only related to one subject and would be covering the corresponding questions. So for medicine, surgery, gynae, 120. For ENT, opthal, pedia, 60. On the 4th Sunday of every month, you will have another NExT pattern grand test, which will be from either ENT, opthal or pediatrics. As I said, the schedule would already be there under your test series section. So anyone who has access to online test series of DAMS would also be getting this, right? So if you have access to test series, this is already mapped into your course, and we are starting from the 2nd Sunday of July itself. I think the first upcoming NExT pattern GT would be surgery. Okay.
Okay, and this year we are also planning that how we will do a revision program. We will do a revision program for the NEET PG students also, for the NExT also. So don't worry, we will conduct DVT for the NExT pattern as well as for NEET PG pattern. And a lot of students have asked us, will you do it for both of them? We will do it for both, because the number of students are different. Final year students will have to appear for NExT. Interns, post-interns have to appear for NEET PG. And I am committed to both of you that I will do a revision program for you as well. Plus, what we have done is that many students, they are self-learners. They study on their own. So we have released 2 review books.
Okay, before we go to review books, there are 2 doubts pertaining to what we discussed previously. Will the videos be available for the clinical live sessions?
Yes.
Yes. So, DAMS ka ye rule hai. We do it live and then the videos are automatically available for you. So, we will stick
in all programs.
In all
DAMS programs, even Foundation, Ultimate Live, NEET Clinical, NExT Clinical Live.
Okay.
All the live classes are recorded and uploaded for you for any number of times review. You can see them
then
again.
Can TND people access grant tests? Of course, yes. I just said, if you are a DAM student, you have access to OTS online test series, which actually is given to everyone. Whether you take pre-recorded videos or TND or Ultimate App Live, you have access to online test series, and you can start giving these NExT pattern grant tests along with NEET pattern grant test. We are not discontinuing NEET pattern because there is one last NEET to be held. So, gear up for both of them. Have enough practice of both of them. Okay.
And the books that I was talking about is that for the NEET PG, the review book will be NEET PG ka first aid. Lot of people are getting confused. This is subject wise review, which covers all the high yield topics for NEET PG and is actually very useful for any kind of exam.
Especially for revision close to the exam, NEET PG ka first aid as well as Synapse. So these books are like super tools, especially a month before the exam, and I mean it. They are really going to help you in your rapid revisions, integrated revisions, as well as subject-wise revisions, especially close to the exam, right?
Both of them are bestsellers on Amazon in the NEET PG and the PG postgraduate medical entrance category. This is the India's first system-wise review. In this, the chapters will be like this: cardiac sciences, respiratory science,
the first
neuroscience.
Of its kind.
Okay. In this, the chapter will be medicine, surgery, anatomy, biochemistry. Subject-wise, this is system-wise.
Yes.
Different approaches, totally different. Both of them have their own beauty, and we believe this is how the exam is moving towards.
No, the pattern is unlikely to be USMLE type because there is a gross difference. USMLE is extremely long stem questions, right? Whereas here they are going to strike a balance, right? So it is going to be applied questions. The format is applied, but you will still have a bit of everything. Believe me, you will have a bit of one-liners as well. You can't rule them out. There are certain things which seem like one-liners but are clinically very important. So 60%, as they said, are analytical questions which will be short stem clinical vignettes, right? Most likely.
So if I summarize what we have discussed today is that probably we'll have another last NEET PG. This is now looks more likely looking at the Gazette line which says that in the interim period they will have a NEET PG. December FMG exam may happen, may not happen. We are putting a Q mark here. It is possible, it is not possible. We don't know right now. It is right now in very tight scales. Next Gazette is published. Once it is published, that means these are the rules and regulations, and this is how the government will move forward. It is like a law which is now framed for the next exam. We have already discussed in today's videos. If you are joining late, please go back and see the rules, scoring method, how they will use the raw score only.
How can you repeat?
How can you repeat to pass? How only the last next part 1 score will be used for PG.
For NEET PG.
We
for
have
PG entrance.
And the validity also. We've discussed all the things. Validity will be 5 years. Validity of your score will be 5 years.
Yes, your score is valid for 5 years.
But if you appear again, then the previous becomes invalid.
Yes.
Only the latest next part 1 score will be used. You can repeat your next part 1, but only after giving the next part 2. All this also tells me that if you are right now a third year or a final year student, you need to gear up. This is like they have said, if you have more attempts, you will in the tiebreaker they will pull you back. You need to make your first attempt your best attempt. Start working on it now. Give focus on your clinical subjects. Third and fourth year subjects are like gold now. Don't miss out on any of those subjects. Please start studying as soon as possible, almost immediately possible.
Okay, somebody is asking about the GT schedule. A simple rule is second, third and fourth Sunday. Second Sunday of every month. Next pattern GT, which is subject wise. The date is mentioned. It is already there on your online test series grand test section. Third Sunday, NEET pattern grand test, which comes with video discussions, and it is going to be a 300 MCQ paper. Fourth Sunday of every month will be again another next pattern grand test. Again, the schedule is already updated under the grand test section. So go click it and see the dates.
Okay. A lot of people have asked about third year MBBS exams. So what the government has already done is that third year MBBS, other than 1 or 2 batches which are remaining, now has PSM and FMT. In the new batches, third year is now community medicine and forensic. I know there are few batches where the ENT ophtha is also there, but after that they have streamlined it. So what will happen is third year MBBS exams will continue as it is. Okay, even if you have ophtha ENT, you will have to appear for them. Fourth year, the theory exam will be replaced by next part 1, but the practical will continue happening as it is happening right now. Okay, so this is very important that even if you are right now your third year MBBS includes ophtha ENT, still you will have a separate third year theory exam happening in the university level. Okay, also some students have asked, sir, how should I approach the mock test? So first of all, approach to the mock test should be based on the fact that it is a mock test. It is not going to determine your ranks or score. Don't get depressed that I'm not doing well, I'm finding it tough or easy.
Yeah, it
is just to familiarize you with the style of the paper. But they have already mentioned that real exam difficulty and the topics can vary. It is just to give you an idea on how the paper, how the exam system will feel like, including the computer centers. Second thing a lot of students have asked is, I am in first, second year, what should you do? So if you are right now in first or second year, this is the right time to make your basic sciences very strong. You have to make sure so that in third year you can apply all those things in your clinical.
And you can start somewhat of clinical as well, which is what we even aim for you. So in second
DAMS,
year,
we have a course in second year called as Pre-Foundation, where we teach you Path, Pharma, Micro and your first year subjects. Now we are introducing ophthalmology also this year. We are starting ophtha. If ophtha is done well, we might add one more clinical subject in your second year itself to give you extra edge.
Okay, two doubts that I can see. Somebody's asking, suppose I pass next one, but my score is not good. Can I reappear? Of course, yes, you can. You can reappear, but you will have to reappear for all 6 papers, okay? And the score of only the most recent test, next one that you give will be counted. So the previous score will not be eligible. Only this particular current year will be eligible.
Okay, so I hope you understand you can only repeat after you pass your next part 2. Suppose aapne next part 1 you're given, you're not satisfied with your score, you will still have to pass the next part 2, then you can repeat, provided you have passed both these steps within 10 years of your joining MBBS. Okay.
Okay, then there was another doubt. Should ultimate app live student watch the next clinical live sessions? Of course, yes. Why not? See, even your exam is MCQ oriented, and like me and Dr. Sumer say, every day you should practice some MCQs. And what can be better than practicing it with the faculty itself, where we are not just killing you the answers, it has to be actually the approach to the questions, how to integrate your material in one question, how to apply the things in the question, right? So please attend the clinical live sessions. We are doing it for you. The teachers are not doing it for their revision, okay? Sometimes you feel the teacher is coming to revise what they have to teach. No, it is for you. We are taking this initiative for you despite our super busy schedules. Please understand the clinical subject teachers are doing a lot of things parallelly. So if they are taking out time, it is just for you. Okay.
So I think some students have joined late. So I'm just repeating. If you are starting now and you have not done the theory of the 6 subjects that they have mentioned in the next, on DAMS eMedicos app, there is a course called as Foundation Live, in which we are starting a new schedule from 10th of July, where we will cover medicine, surgery, obs-gynae, ENT, ophthal and pediatrics live. That means it will be 2-way live teaching. Also on the day 1 of joining itself, you will have back to basics live videos, recorded videos of all 19 subjects. So ye live padhayenge, recorded bhi hoga. But if you have already done your foundation course and you are already with us with a TND,
follow up with TND,
or if you are still doing foundation, whatever, these sessions will be the game changer, where every day we are doing next live clinical sessions where analytical MCQs, which will form 60% of your paper, will be discussed and how to approach them. And this will be done every day, so that at 9 to 11 p.m. I know
3 days a week.
Yes.
Okay.
So we will do it 3 days. Then Saturday, Sunday, you have your own classes in face-to-face centers, etc.
Right. So 3 days a week, you will have these next live clinical sessions, which are MCQ discussion sessions. And anyone, if you're enrolled with DAMS, you actually have access to this, because we are giving free access to all our own DAMS students, irrespective of what course you are in. Okay.
So I hope this gives you the idea. Plus, we have already in our DQB DAMS question bank, recently we have added clinical vignettes in each subject, and separate integrated questions are also present in the app itself, which are multi-subject questions.
Okay, something else that I want to tell you is that when we do these next clinical live MCQ sessions, we will upload the videos, and we will also try and upload the annotated PDFs as well, especially for these clinical live sessions. Okay, since these are MCQ sessions, we will upload the annotated PDF on the app itself.
So for those of you who are new to DAMS, let me explain. So whatever the teachers will be writing down in these next clinical live sessions, same PDF will be uploaded below the video in the soft copy format, so that when you want to review fast, annotated PDF will also be there.
अच्छा, एक बच्ची बार बार पूछ रही है वेटेज ऑफ अलाइड सब्जेक्ट्स. बेटा ऐसा कुछ भी मेंशन नहीं है,
कहीं पे भी लिखा
क्योंकि
नहीं
यू कांट सेपरेट. ओके, इफ देयर इज ऑब्स एंड गायनी देयर विल बी रेडियो, इफ देयर इज मेडिसिन देयर विल बी रेडियो, देयर विल बी सम अमाउंट ऑफ साइकियाट्री इवन इन ऑब्स एंड गायनी. सो अलाइड,
देखो अलाइड
के लिए वेटेज
मैं
इज नॉट
समझाता हूँ
मेंशन.
दोबारा. अलाइड का मतलब अलग है, अप्लाइड बेसिक साइंसेस का मतलब अलग है. ओके, थोड़ा सा कंफ्यूजन है इस गैजेट के अंदर, क्योंकि जब हम उसको पढ़ते हैं तो अलग लगता है. अलाइड एमसीआई की पुरानी डेफिनेशन है जो कहती है मेडिसिन सर्जरी के साथ ये सब्जेक्ट्स अलाइड है. Skin anesthesia, radio, psyche, ortho, which we are inseparable. Like orthopedics is a chapter in Bailey and Love also. Radiology images are present in every book. Psychiatry, dermatology are there in your Harrison's also. Yeah, so what happens is these are actually part of these two subjects. But in our traditional coaching method, we teach them separately. Now they are saying they will be allied in the paper. But the key word is the applied aspect of basic sciences, including PSM and forensic, will be there 10% in every paper. That means some questions on applied anatomy, some questions on, like for example, in obs and gynae, they will have the RCH or program.
So for example, see in surgical
of the blindness program.
So in surgical subjects, the applied basic sciences would be basically anatomy, pathology. In medicine, the applied basic sciences would be physiology, again pathology, pharmacology, right? So the applied sciences basically will be 10% of the total number of questions in every paper.
But I want you all to understand, many people are saying, अच्छा 10% छोड़ देंगे, फिर the ranks will suffer. Then the ranks will be suffering because these questions, like in our current mechanism also, if you notice, the first, second year are the rank determining subjects, even in NEET PG right now, because most people are okay in clinical, but basics they don't know. So these will become more and more rank determining. I would recommend, if you are a topper,
I was coughing, so I turned it off.
If you are a topper category student, don't ignore them.
Okay, I think we have pretty much sort of answered all the queries.
Okay,
now.
one बच्चा is saying, sir, बाद में डैम्स क्या 6 दिन का mock test भी लेगा? Definitely we will take it.
हम हर कुछ
But
करेंगे.
we are going gradual on it, because if I say tomorrow you have a 6 subject GT,
you won't even appear for it.
You won't appear for it.
Like
Even
you are thinking about mock.
Even the exam board is not taking a 6-day mock, because they know you will not go for it right now.
Yes.
We have to make sure that you're prepared before we subject you to a test match. So right now we'll go gradual, but definitely we will have the full simulation of the exam.
Yes, 10% applied includes PSM, includes FMT, includes your first and second year subjects as well.
So if you're starting now and you want to accelerate everything, I would suggest you can go for the hard copy notes, attend the foundation live, prioritize the 6 subjects first, then go for the recorded videos of the shorter subjects. Then if the time remains, then only think of going for the applied part of the first, second year. But at least start right now, because we know the exam will happen twice a year, November and May. Don't be misguided that you have to study more. It is not so. Must know topics will form 60% of your paper. Nice to know 30%. 90% of the paper will be usual things in the paper. We have to make sure that we have usual things under command. If I take too many attempts in the tiebreaker rule, I will go down. If I don't do well, to repeat, I will have to wait for my internship to get over, pass the part 2, appear for all the 7 tests in the part 2, then give the exam. So please take your first attempt very seriously. Start now. Don't think that I am delayed, so I cannot do it. It is important to start and look at the time forward.
Third year, we already gave you the strategy, but if you're a third year student, you have to focus on your third and fourth year subjects, and for that you have Foundation Live, right, which gives only third and fourth year, and Ultimate Alive will give you third, fourth year with all other subjects as well. So you can see for yourself which one do you want to join, because everything is eventually going to be asked, maybe in an applied manner, but it is going to be a part of the paper.
Usually if you are a third year and if you are already studying in a DAMS free foundation course, you have made your first, second year notes, straight away go to the foundation course. If you have not done so far, go for the ultimate live course so that your basics can be made. Otherwise, you will always keep thinking, "Ye anatomy kahan pe thi?" I always see that when I'm teaching radiology, I have to tell aortic arch goes anterior from anterior to posterior, and a lot of 3D has to be taught to you. Second thing is, if you have done all of this and you are in fourth year, then you can go for test and discussion also,
Yes.
so that you can have the extra edge.
And you know, our T&D papers are anyways not from today, but from almost a couple of years. They're completely clinical. You will see we have a lot of clinical vignette style questions. In fact, we include true and false also. We include multiple completion type also. So our T&D papers are very reflective of the main exam. So no matter if you have covered your theory once and this is the time that you're spending, you can definitely join the T&D. With that, you will also get access to the next clinical live classes from which are being held at night.
You know, I think that what will happen is with the next clinical live, we have kept the idea of how to look at analytical MCQ, and we'll do it every day in 3 days a week.
Yes.
So what will happen is we'll cover all the clinical subjects with this. This will serve as a revision for you if you have been a DAM student, but it will also help you to apply in the exam.
Yes.
We believe
That's
it
the
should
entire
be the game changer. So that's why we have included this particular course in Foundation, Back to Basics, Ultimate Live, Next, and in the T&D also. So that you don't have a problem to play again. We have, if you are a DAM student, it is included in your subscription.
Yes, yes. Ultimate App Live gives you access to everything. It gives you access to the entire online test series. You get class test, grand test, subject-wise test. You will also get the new clinical live series with it, right? So you have access to the entire online test series.
So let me explain. Ultimate Live course gives you a course called as Ultimate Live, where 19 subjects are taught live. You also get Foundation Live.
You also get Back to Basics,
where the clinical subjects are taught live. So 2 calendars are there. You can choose 2 live channels are available to you. You get Back to Basics, all 19 recorded.
which are pre-recorded videos of all 19
You get
subjects.
online test series with video solutions, including the next mock tests. And you get DAMS question bank, access to all the short courses, including DVT for revision. Okay, so this is in a nutshell what the Ultimate Live course includes. Foundation will have the same. The only thing is all 19 live will not be there. Clinical live will be there. That's the difference between the two.
All right, so I think pretty much covers everything. If you have any doubts, please join our Telegram channel. The faculty is very, very active. Me and Dr. Sumer are also active. It is the official DAMS eMedicos channel on Telegram. So you can be a part of that. We discuss a lot of things apart from MCQs, right? Everything that's relevant or medically relevant is discussed. You can reach the teachers also directly.
What I will do is, in the description of this video, I will share the link of the Telegram group. So it's already there. I think if it's not there, I'll share it again so that you can join the Telegram group and we can continue the conversation there as well. Now, we tried our best to read the Gazette with you.
Yeah.
And I would strongly recommend that you read it with you again with your own eyes. Don't just wait कि मेरे दोस्त ने ऐसा कहा है कि उसमें ऐसा लिखा है. ये आपका एग्जाम है, जरूर आपको अपने आप देखना चाहिए. Please look at it yourself. Also, have your parents also look at it. It's always a good idea if your parents also are aware of the fact that what are the changes happening. The biggest change is, if you are an Indian medical graduate or a foreign medical graduate, next will be your licensing exam. This is India's first mandatory exam to be passed. It is not NEET PG, which was optional. It is mandatory. I want to clarify, even if you are wanting to go to America, UK, to IES exam, you want to join MBA, but anything you need to do, you will have to pass NEXT first, because without doing NEXT, you cannot graduate. Yeah. That is very important, biggest change that has ever happened in my career as an educator in the last 2 decades plus. So I would ask you, request you, urge you, please read the Gazette yourself. Also, if you have any query regarding the rules and regulation, feel free to ask us. We will try our best to tell you what we feel, what we think about it.
Also, since somebody is asking again and again, yes, now the famous DAMS class notes are available. It's called as the 3C, concise, crisp and conceptual. You can purchase the hard copies directly from the app eMedicos. There is a book section from where you can actually order all these books whether it is DVT or Synapse or 3C ka hard copy. But not just the hard copy, this is something which is separate from the course, so you have to take it. But the the soft copy of this is available in the back to basic videos. So just underneath the video, you have the soft copy also available of the famous DAMS notes. They have everything in it, including images, tables, algorithms, and everything that you need at one place. So if you really want to accelerate your process and you feel you yourself do not have the time or don't or cannot make notes for any reason, please use this. Believe me, this will be something that will really accelerate your preparation.
So please look at today's video as a reminder that once the Gazette is published, it becomes the law of the land. It looks likely. I know some of you will think that ऐसा होगा नहीं, ऐसा हो सकता है, नहीं होगा, but if I was in your place, I would start studying. It is very important. If you are an intern, post-intern, take this NEET PG as probably the final NEET PG that will happen in the country in the current format. Please take it very seriously. If you were waiting around, okay, I may give the exam this year or next year, please do it this year. Number two, if you are a final year MBBS student, time is not lost. Please start studying for the clinical subjects at least, because they will be important. If you're a third year student, it is high time we start preparing. Second year, start getting aware of it. First year, it is important to know that you are entering into a profession where the things are changing. It is not for license is no longer something that you get just by passing the exam. You have a national level exam to be passed with MCQ orientation. With this, we wish you all the best. And we reassure you again that we are committed to helping you navigate through the change. And why we feel that we can help you is because we have seen multiple changes in my career as an educator. When I started DAMS, the exams were happening in a different format. Then a different All India paper came, different state exams came. We navigated through the change. Then NEET PG came, we navigated through the change. Then AIMS got merged into INI exam, we navigated. Still, in the last 2 decades plus, I think more than 23 years now, we have still been able to pass the test of time by navigating every change happening. And I'm sure with the depth of faculty that we have, we will be able to do it for you this time also. So I look forward to meeting you in different sessions. And I personally invite you to the Telegram group to ask your queries regarding the rules and regulations, regarding the preparation strategy. I will answer them personally myself. I wish you all the best.
Yes, just to highlight the 3 new initiatives of DAMS for NEXT is number 1, NEXT Foundation live classes, where our focus will be primarily on the 6 core subjects in the live schedule. The others are available recorded on the app in the same course itself. Second initiative is NEXT Clinical Live MCQ Discussion Series, thrice a week, 9 to 11 p.m. Foundation live classes happen from 5 to 9 p.m. Okay. The third initiative is NEXT Pattern Subject Grand Test, starting from July itself. We are beginning on the second Sunday of every month with the NEXT Pattern Grand Test, which will be subject wise and would be 120 and 60 as recommended or as given in the NEXT schedule. Right. So these are the special initiatives. Plus, yes, we have to accelerate, the 2 famous books, the DVT and Synapse, for your revision close to the exam, and the class notes are there, right? So this is practically what you need. You need theory preparation, an MCQ preparation, or a test preparation, and a revision strategy. Together, these 3 form what you really need to appear for the exam, okay?
And again, I'll repeat, a lot of students are thinking that because this is a new kind of exam, I need to accumulate more material. That is not true. You need to concise your material. You need to concise your material. The
timelines are more crunched actually.
November, May, twice a year. Next part 2 will also happen twice a year. That is what has written in the Gazette. Please read it yourself also. In the part 2, the most important change that I saw in the part 2 is there will be 7 modules that they will test you for. If you fail in 1 or 2, you will have a supplementary. If you fail in more than 3, full practical paper will have to be repeated. Practical exams will also test you on the hands-on skill. If simulation is there, they will take simulation that is written in the Gazette. And at DAMS classrooms, we are already doing your next part 2 preparation with simulation. Right now it is happening in our DAMS Bangalore Center and Delhi Center. Kerala, we have already done this year's simulation exercise. I strongly urge, if a simulation program is happening in a DAMS center, for you, if you are a DAMS student, please attend. I know many of you were not attending कि sir practical नहीं आएगा, आ रहा है. It is important to get the hang of the practical skills. Even the chairman in his address mentioned that skills like CPR, intubation can be tested. So I feel next part 2 is also an important consideration to be thought of.
All right, everyone. So we'll be available for your queries in the Telegram channel as well as personally. Feel free to connect to us. Don't ask us to speculate. Okay, कि ये होगा कि नहीं होगा. It is the government who has to give you the final dates of exams. There is no point of anybody giving any kind of speculations on the dates, right? So let's not try and ask your teachers to be people who speculate things. We can interpret things for you. We can help you. We can help you accelerate the process. But we are not the deciding factors on the dates of the exam. So have patience. They will, when they are so fastly coming up with everything, they will come up with the test schedules as well. थोड़ा सा सब्र करो, वो जरूर निकाल देंगे. Okay?
If you have further queries, which I am sure you have, join us on Telegram, DAMS eMedico's official group. I will be personally answering. Wish you all the best. God bless you and take care of yourself. Don't panic. Every change comes. Initially, we all feel anxious, but we will be able to do it once we acclimatize to the change. We wish you all the best. We will help you navigate.
All right. Thank you, everyone. Take care.